Okay, thank you. Once again, everyone, like I said, my name is Kamilah Hamilton, and I'm gonna pull up my. So I will be speaking about the healing power of water, more specifically constitutional hydrotherapy and its effects on peripheral neuropathy and paresthesia. So first I'm going to do a quick overview of kind of like some definitions or to give you a brief overview of the body systems and what these terms mean. So first, I would like to discuss the nervous system. The nervous system is broken up into several parts. You have the cranial nerves, that's basically nerves that's traveling from the brain into your eyes, mouth, ears, and other parts of your head. You also have the central nervous system, which a lot of you have probably already heard about, which pretty much, I look at it almost like the core, like your brain and your spinal cord. Then you have your peripheral nerves, which once again, most of you have probably heard about. Those are the nerves that are actually coming off the spinal cord and it's going into your peripheral parts of your body. So your limbs, your arms and legs, hands and feet. You also have the autonomic nervous system, which those nerves kind of deal with the visceral organs. So kind of deals with the organs that you can't control, like your stomach, your heart, your lungs, also your sexual organs. Next, what is peripheral neuropathy? Peripheral neuropathy pretty much happens when nerves that are traveling from the brain and the spinal cord going into the muscles and the skins, when that gets damaged or destroyed. And a person will experience a few of these symptoms that you will see right here. In general, people tend to experience more so like the numbness, the prickling, the tingling. We also will call it a sock and glove type sensation, where the person will feel like they have socks on or some gloves on, and they'll have that feeling. You also have different types. So the different types, you'll have polyneuropathy, which will involve several nerves. You may have mononeuropathy, which will, which will involve just one nerve, which, for instance, if somebody has carpal tunnel, where the median nerve is being pressed upon. So that is an example of like a mononeuropathy.
Kamilah?
Yes.
Real quick, your screen share got disrupted.
Oh no. Better?
There you go, you're good.
Okay, thank you.
Mm-hmm.
There we go. So the next term I wanted to talk about was paresthesia. So paresthesia pretty much is the sensory disturbance. So all of us have pretty much have had the feeling of like, oh, my foot fell asleep. So that happens when you have like a nerve that has like, there's just briefly had some pressure on it, like say you were sitting with your legs crossed for too long, or you had some type of poor circulation. So the nerve could be compressed, irritated, or inflamed. And a lot of people that are at risk for this are people that perform repetitive movements, heavy drinkers, people who have poor diets, people that have type 1 or type 2 diabetes, autoimmune, or some type of neurological condition like MS. So now, what is constitutional hydrotherapy? So first and foremost, let's talk a little bit really quick about hydrotherapy. So hydrotherapy itself, if you break that word down, hydro means water, and therapy, of course, is the form of using something in order to help treat a person. So hydrotherapy itself is the use of water, maintaining the health or treating a disease by stimulating the body's own self-healing mechanism. Constitutional hydrotherapy itself involves alternating hot and cold towels on the torso in combination with electrical stim pads to stimulate circulation and promote natural detoxification. This will allow the flow of nutrient-rich oxygenated blood through the tissues and vital organs. Some of the benefits to constitutional hydrotherapy are, as you see right here, reduced inflammation, increased energy, improved digestion and bowel function, improving sleep, also decreasing stress, and strengthening the immune system. Now, just to backtrack a little bit, hydrotherapy also not only consists of constitutional hydrotherapy, which is what I just described, but it also involves sitz baths, saunas, full immersion. So my question was, can hydrotherapy be beneficial in treating paresthesia and peripheral neuropathy? In other words, can water be healing to the body? So it's not a whole lot of research on this, but I did find 4 research articles. The first one that I would like to discuss is pretty much, it was a review study that was done in 2014. And a review study, for those of you who are not in the medical field, basically is when somebody goes and takes a whole bunch of studies, looks them over at the results, and kind of puts it together into one nice paper. So this particular study looked at all of the benefits that hydrotherapy has on various body parts. I won't go over all of these individually for the sake of time, but I'll pick out a few things. For example, the GI system. Studies have been shown where a sitz bath can relieve rectal burning, or immersion in the deep sea water can reduce blood glucose in type 2 diabetes. Another thing would be, say, the cardiovascular system. Cold exposure to small areas can result in increased blood flow to tissues. They found that peripheral circulation actually increased in cerebral palsy patients as well. We could take a look at eye, skin, and hair. In that little section down here at the bottom, what I found, what was very interesting and may perk some people up, but a cold pillow compress was shown to reduce hair follicles inhibition or damage caused by chemotherapy, thereby possibly helping people who are suffering from alopecia, but don't put all your eggs in one basket on that. The second study actually looked specifically at hydrotherapy and peripheral neuropathy. They took 27 patients and they did this study for 8 weeks. Be mindful that this study involves self-administered hydrotherapy. So keep in mind when you look in studies, sometimes studies will have kind of some possible negative effects with it. Because this was self-administered, you run the risk of patients possibly not doing the hydrotherapy correctly. But they were supposed to do it for 8 weeks and do at least 2 of hydrotherapy treatments per day. And that involved the knee effusion, which is pretty much water going directly on the knees, a cold foot bath, alternating cold and hot foot baths, and also wet socks. With the results, they did find that pretty much people really like the knee effusion hydrotherapy. They found there was a decrease in abnormal sensation, numbness had improved. There wasn't a big significant difference in pain, but it was very slight. They did not see any difference in muscle weakness, however. Acute relief was reported after 30 to 62% of applications. Other results that I found interesting in this study was that after the first 5 weeks, there was a plateau at 35% of the time. So I found that to be very interesting. Also, there was a slight improvement on sleep, ability to perform daily activities, and also anxiety. The third study was done in 2017, and pretty much this one was looking at dealing with patients that have peripheral neuropathy and pretty much kind of pitting aquatic versus land physiotherapy against each other. So with the aquatic, they were actually in the pool doing different types of exercises in the pool. They used 40 patients, 21 water-based, 19 land-based, and this particular study happened over a 4-week period of time, and it involved 3 sessions per week. With the results, the aquatic patients actually had better results for gait improvement, but the land-based therapy had better results for ambulation. Ambulation is the walking, people being ambulatory. Both showed improvement with balance. So something like this, I would say like a patient would probably fare very well if they kind of did a combination of the aquatic and land. The last study, this one is results pending. So like I said earlier, it isn't a lot of studies out there for this. However, it was good to see that there actually is an interest. So at least studies are trying to be done. Now, the goal of this study was to determine the effectiveness of hydrotherapy on neuropathic pain in individuals with spinal cord injuries. As some of you know, I am an ultrasound tech, and I work at the Ability Lab, and I deal with a lot of spinal cord injury patients. So this was kind of close to my heart. They used 28 participants in this and 14 in each group, and it was a 9-week study, and they did 2 weekly sessions. And one group did hydrotherapy, and the other group did just the standard physical therapy. And they're pretty much hoping to see that hydrotherapy kind of fared better. What they're going to use as far as their measurements, they're going to look at the level of pain and its effects on the person's life. They're also going to look at the disability and the quality of life of that person. This study was due to actually end like September of this year, but because of COVID, who knows what's going on with this study. So on to my actual case that I had in the clinic. So I had a 43-year-old female who had a chief complaint of numbness of limbs and dizziness. Now, she came to the clinic September 10th of this year. This young lady actually went to several doctors. So we were kind of like her last stop. Just to let you know, as far as paint a picture of this patient's lifestyle, she is currently a housewife. She homeschools 2 children, and she started a business. So her symptoms actually started 2 years ago. And what happened with her 2 years ago was she had completed her first marathon. And 3 weeks after she completed her first marathon, she experienced numbness in her feet and hands, and they spread to her arms and legs. The patient was stating that the numbness was constant. She was getting pins and needles when she would first wake up, and then it would go away after a while. But for the most part, her right arm and left leg was mostly affected. She rated at that time her paresthesia, numbness, and dizziness all at 5 out of 10, 10 being the worst. The medication and supplements that she was taking, 4 months before she saw us, she started taking iron, vitamin D, B complex, zinc, and sertraline was prescribed to her. The patient was also doing omega-3 and a multivitamin 3 to 4 times a week. Just a little background, we had so many labs that she gave to us as well as imaging. So initially she did have low vitamin D and B12 as well. By the time she came to us, those levels were normal. When I did a physical exam on her, everything was normal with the exception of her hair was thin and dry. And when we did like a sharp dull test on her, S1 dermatome, it was just a small section of the lateral 5th digit. And for those of you that are not in the medical field, pretty much that little small spot right by her pinky toe. The labs that I ran on her was a thyroid panel and an HbA1c, because like I said, she came with all of these labs and imagings already done. And pretty much she was looking for what is the cause of this. And unfortunately, doctors couldn't tell her anything. Those labs that I ran on her came back normal. And I felt bad because I felt like I can't tell you anything either. But one of the things, unfortunately, is just one of those things we call it idiopathic, where if there isn't a known cause, we would call it idiopathic. So the treatment plan that I gave her, I told her to continue her supplements, her medications, even increase that omega-3. But we added in constitutional hydrotherapy, which she started on the 23rd of September. We also did soft tissue and homeopathy, and later on she would do a full body massage as well. And here's an update. So 1 week after treatment, she rated the tingling as 2 out of 10. And mind you, everything is 10 being the worst. So it's on the scale of 1 to 10, 10 being the worst. So the tingling was rated as a 2, numbness rated as a 5 still. The mental clarity, she said she had a 5% improvement. 2 weeks after her first treatment, she went camping and she reported she had no dizziness. The morning pins and needle feeling had 50% improvement. She rated the tingling still at 2 out of 10. The numbness at 4.75 out of 10. Mental clarity had improved about 10%, and her arms mostly improved. After 3 weeks, she was feeling 50% better, feeling more like herself. She went to Indiana Dunes the Sunday before and had no dizziness. She had 20% mental clarity. The needling feeling was down 50%. The numbness in her arms improved, but she still had the numbness in her legs. 6 weeks after, I found it interesting that she reported her sleeping was better. She no longer was waking up in the middle of the night and waking well rested. 8 weeks after, which actually was earlier this week, she said she rated her clarity of mind 3 out of 10. Her numbness and tingling in her arms was a 1 to 2 out of 10. Her dizziness was still present, especially if she was walking and she looked down at the ground. Also, too, I love the fact that she said her husband had told her, "I feel like I have my wife back." The patient was saying that she felt she had more energy and she was doing even more cooking. So I was really happy to hear that. And these were my resources. Were there any questions? I know it was kind of fast, guys. Sorry.
That's good, Kamilah. Very good. Very good case, too.
Yes, and I will say this. One thing about her case is I feel there's layers to it. I honestly feel that stress is a huge part for her. When it comes to stress, I feel that's what brings on the paresthesia. Basically, she did experience this before, like years ago, and she said she was going through some stress at that time. Also, too, interestingly enough, while I was doing her treatment, she did report at one point in time that she felt she was right back to square one. She was back like when she first walked in the door. But what was interesting was she actually did something extra with her business. She actually decided to rent out a space. And I feel that kicked up the stress and made her kind of backslide, so to speak. But like I said, I saw her on Wednesday and she's doing really well. She was like, "My arms, I'm really not feeling it." She still had it kind of in her legs. I saw somebody had a question. What was that?
Let's see. So everybody's saying good job, which I agree. Russ wants to know any consideration for nutraceuticals. He says, also, I see some research for diathermy for nerve regeneration in peripheral neuropathy.
Ooh, okay. The patient has brought different products to me to look at. One recently, now this patient is from a different country, and her mom was saying, her mom sent her some information, and I have looked at some some supplements that I felt would be good for her. I haven't looked at anyone in particular per se. And Jasmine, I think, had a question about how many times a week or how often, but she was coming once a week for the hydrotherapy. And then after the hydrotherapy, we started doing soft tissue, or she would do a full body massage.
Awesome. All right. Let's see. Someone said, thank you for breaking down terms for non-medical professional. That was very well done, Kamilah. Very well done. Any other questions, you guys? Doesn't look like it. So great job, Jim and Kamilah. Next week is the Friday after Thanksgiving, so it is a bye week. So we will resume, I believe it's December 4th, and I want to say that Mari Seda will be presenting. But of course, keep an eye out for the email, and I will see you guys all back here in 2 weeks from now. So great job, you guys. Thanks. Have a nice day and a nice weekend.
Happy
Bye.
Thanksgiving.